So, today I'll be telling you about gastrointestinal infective syndromes. This is the basic requirement. The learning objectives for today are that you have to know about the type of diarrheal diseases, infectious agents causing acute diarrhea and the underlying mechanism regarding that. Then identification features and detection method, that means the diagnostic methods for diarrhea, dysentery and all other gastrointestinal infective syndromes. As you all know, there is a lot of resident microbial flora as it is present on the skin. The same way it is present. So, the same way human GI tract, gastrointestinal tract, is also colonized by diverse group of normal resident microbial flora, which means they are always present there. They change only with the taking of antibiotic or change of environment and water or food quality. They are otherwise normal. They are not causing any pathogenesis. Then upper GIT contains only sparse, that means less bacteria. They are generally streptococci. So upper GIT contains less bacteria, that is streptococci and lactobacilli. They are present in the oral cavity. Then there are bacteria in the lower GIT also. The microbial load generally increases towards the lower part of GIT and is highest in the distal ileum. Talking, the lower GI tract has a larger load of resident flora, almost to the extent of 10 to the power 11 or 10 to the power 12 grams per cc. Now, the large bowel comprises of both anaerobes and aerobes. Even in the mouth there are anaerobes to the rate of almost 1000:1 with Bacteroides fragilis. So normal flora also comprises of, besides bacteria, it also comprises of yeast and parasites like Entamoeba coli. Now, first thing which it may not be a syndrome, it's just a symptom, that is stomatitis, which is the inflammation of oral cavity. It can be caused by bacteria like spirochetes, Fusobacterium species, etc., or it can be fungal, caused by Candida albicans. It is usually called thrush. Others are, there is a fungal infection, histoplasmosis, which is a disseminated type of infection, and this can also cause oral infection. Then there can be viruses which can cause infection like herpes simplex, Coxsackie A, measles and chickenpox, enteroviruses, etc. as hand and mouth disease. It is very common in children. These days children are suffering with hand and mouth disease. Then there is Vincent angina. It is caused by Borrelia vincenti and Fusobacterium. Now this was stomatitis. Now I am telling you causes of peritonitis. I have not dealt with these two in detail, but I'll just let you know the causes of these two infections of the GI tract. That is, it can be a primary peritonitis. You understand what is peritonitis? It is the infection and inflammation of peritoneum. Peritoneum is the layer which covers all the organs in the abdomen. So this peritonitis can be primary in children. Mostly the causes are strep pneumoniae, strep pyogenes, Then M. tuberculosis, Mycobacterium tuberculosis, coliform bacteria in Staphylococcus species. In adults, most common is Escherichia coli, Streptococcus pneumoniae, M. tuberculosis, and Neisseria gonorrhoeae. This trachomatis is a cause in sexually active young women. This peritonitis can be secondary as a consequence of an underlying process in the abdomen, like there can be a perforation, like perforation of appendicitis or any other ulcer in the intestine. So, etiological agent depends on the pathological process which is causing this peritonitis. Then GI syndromes are generally classified as diarrhea, dysentery, traveler's diarrhea. Diarrhea can also be persistent or chronic diarrhea. It can be gastroenteritis, food poisoning, acute vomiting, necrotizing enterocolitis, necrotizing enteritis, pseudomembranous enterocolitis, tropical sprue. I'll explain all these later. Peptic ulcer disease, etc. Now, diarrhea is a leading cause of illness all over the world. It causes significant morbidity and mortality. To the range of 5 billion cases occur per year and 1.26 million deaths have been noted world over per year. This is a general statement. It may differ from year to year. Now, diarrhea is defined as a passage of 3 or more loose or liquid stools per day in excess than the usual habit for that person. It is caused by microbial infections or a result of other gastrointestinal diseases such as inflammatory bowel disease, IBD in short, then celiac disease, etc. Then acute diarrhea lasts for less than 14 days. Most often this is caused by viral agents, bacterial or parasitic agents. Then there is one term, dysentery, which is generally confused with diarrhea, but dysentery means that it is diarrhea with increased blood and mucus in the stool. This is associated with fever, abdominal pain, and tenesmus. Tenesmus means there is a constant feeling of passing stool even though the colon is empty. These are the infectious agents of acute diarrhea and the underlying mechanism which causes the diarrhea. First of all, the mechanism is non-inflammatory. These agents do not cause inflammation in the intestinal mucosa. The location is the proximal. Proximal means the upper part of the small intestine. Illness is watery diarrhea. Then the bacteria most commonly are Vibrio cholera, Escherichia coli, Clostridium, Bacillus, Staphylococcus, etc. And there are some parasites which also cause non-inflammatory diarrhea. Blastocystis hominis is one of the important ones. Giardia may also cause dysentery. Non-inflammatory other causes are viruses and fungi like Microsporidia. Rotavirus is important in children, infants. Norvovirus is generally important in traveler's diarrhea. Then there are many parasites. There are helminths. In the first slide, I had shown all the protozoans. Here they are helminths which are causing the diarrhea. Then the other mechanism of diarrhea is inflammatory, where there is invasion of the mucus with the parasite or the microorganism, or it may be because of the toxins produced by the bacteria, which can cause inflammation of the mucous membrane of the intestine and cause diarrhea. So the location is generally the colon and the distant part of the small intestine, the lower part of the small intestine and the colon. Here it can be dysentery also and inflammatory diarrhea. Then agents are generally for dysentery. First important cause is Shigella species, Campylobacter, and enterohemorrhagic. As the name itself says, it is hemorrhagic. It causes the person to lose blood. This is enterohemorrhagic. Enteroinvasive. This E. coli invades the mucous membrane. Then there is Vibrio parahemolyticus. These are for dysentery. For diarrhea, there are Yersinia, Listeria, Plesiomonas and Klebsiella, etc. Then there are parasites also which predominantly cause dysentery. These are Trichuris, Trichura, Balantidium coli, etc. Now, another mechanism is penetration of the mucous wall of the intestine. The location is generally the distal small bowel. Illness is enteric fever. What is enteric fever? You all know what is enteric fever? Typhoid. Typhoid is also called as enteric fever because Salmonella causes typhoid, and the first infection which it causes before going into the blood, etc., is in the intestine. So this is Salmonella typhi and Yersinia enterocolitica. They cause typhoid-like illness. Now there is one term, traveler's diarrhea, mostly travel-related infectious illness. It generally appears, the diarrhea presents in first 3 to 5 days. And is characterized by sudden onset of abdominal cramps, anorexia and watery diarrhea. The illness is generally self-limited, lasting for almost 1 to 5 days. It is caused by enterotoxigenic E. coli. In short, it is known as ETEC, and by enteroaggregative E. coli, that is EAEG. Campylobacter jejuni is very common to cause traveler's diarrhea in Asia. Then there is one virus, norovirus, which causes traveler's diarrhea. Generally, it is a carrier mediated. A person carries this virus and transmits, so it is generally seen in hotels and cruise ships, etc. Now, the other term is persistent and chronic diarrhea. If the diarrhea lasts for more than 14 days, it is considered persistent. Chronic diarrhea is generally that which lasts for more than 4 weeks. This may result from infections due to various organisms like parasites. All these parasites like Cryptosporidium, Cyclospora, Entamoeba and Giardia, they can cause chronic diarrhea. Parasites will generally cause chronic diarrhea. Then there are certain bacteria also like Clostridium and Campylobacter. Some viruses like cytomegalovirus in immunocompromised hosts, and fungi like Microsporidia in immunocompromised hosts are seen. Then there is one term, gastroenteritis. After dysentery and diarrhea, there is one term, gastroenteritis. This is inflammation of the mucous membrane of both the stomach as well as the intestines. So it results in diarrhea because there is inflammation of the intestine, it results in diarrhea. And because stomach is also inflamed, there is vomiting and pain abdomen. This can be present without mucus or blood in stool. There is fever, and because of the loss of lot of fluid because of vomiting and diarrhea, dehydration may happen. There is one term, food poisoning. It refers to illness acquired through consumption of food or drink contaminated either with microorganisms or their toxins. Food poisoning is generally because of the preformed toxins in the food, generally staphylococcus or any other typhoid, etc. Now, the diarrhea and dysentery, these are the important things are the size of the inoculum, what the quantity of the bacteria digested, taken in, or the toxins which have been taken in, then the adherence of the bacteria to the wall of the intestine, then the toxin production and invasion. So, if there is attachment within or close to the mucosal cell, these are the organisms like E. coli, Cryptosporidium, rotavirus, norovirus. Then the invasion of the intestinal mucosa and cells is by Shigella species. You understand, all those species, all those bacteria, parasites which will invade the tissue, they will cause dysentery, because then they will lead to loss of blood. So these are the invasive type of pathogenic bacteria. Then there are certain bacteria which will produce dysentery and diarrhea because of toxins they produce. The toxins can be of three types. Enterotoxin, entero here stands for the intestine, the toxins which will have an effect on the intestinal motility. The enterotoxins are produced by, like cholera toxin and Vibrio parahemolyticus, E. coli, etc. All these organisms produce enterotoxin. Then there are certain bacteria which will produce cytotoxins. Cyto means which are toxic to the cells. So they are cytotoxic, produced by Shigella, enterohemorrhagic E. coli and Clostridium difficile, that is the toxin B of the C. difficile. Whereas enterotoxin was C. difficile part A. Then there are neurotoxins which will affect the nerves. They are produced by Staphylococcus, Bacillus and Clostridium botulinum. The predisposing factors, everyone who eats infected food may not have a infective GI syndrome. There are certain predisposing factors like people whose normal flora is suppressed. Generally, the normal flora helps to fight the infective organisms. Because of the abundance of the normal flora, they fight away the infecting organisms. But if this normal flora is suppressed, maybe because of antibiotic intake or otherwise, then they will predispose to infective diarrhea. Then neutralization of the gastric acidity. Some people take antacids regularly. So the acidity of the stomach is, the pH of the stomach is more than the required. Then there are certain people who have achlorhydria, and in such cases there are organisms which will cause gastroenteritis. Then if there is inhibition of intestinal motility, age and location, antibiotic associated impaired host immunity, which means the person is immunocompromised, then genetic determinants are always important. Then there is a difference between enteritis and colitis. Enteritis is the infection of small intestine, whereas colitis is the infection of colon. In enteritis, the volume of the diarrheal stool is large and they are frequent, whereas in colitis there are small volume of stool is passed, but the urgency of passing the stool is more. There is weight loss in enteritis. Colitis may it's not much. Then pain abdomen is absent in colitis. In enteritis, in colitis, there is cramping lower abdominal pain. Then bloating, which is the a person feels that there is lot of gas in the abdomen. That is usually present in enteritis and not present in colitis. Then there are agents which cause food poisoning. Generally, the incubation period of food poisoning after intake if the incubation period is 1 to 6 hours after consumption of the infected food, we generally think in terms of Staphylococcus aureus, Bacillus cereus, which has a preformed toxin. You understand, this is a very short time, 1 to 6 hours में ही अगर food consumption के बाद अगर gastroenteritis या food poisoning, which means vomiting, diarrhea वगैरह हो जाए, which means there was preformed toxin, है ना? The food which you have eaten is already having the toxins. If it is 8 to 16 hours, then generally Clostridium perfringens and Bacillus cereus are thought of. More than 16 hours, there are many bacteria, even cholera and non-typhoidal salmonella, etc. are thought of. Then there are syndromes of hepatobiliary infection. In the liver, it is hepatitis. An abscess can be formed. Gallbladder may it is called cholecystitis. In bile duct system, it is cholangitis. This is the inflammation of the common bile duct, usually by bacteria ascending from the junction with duodenum associated with gallstones. You understand, the gallstones generally lodge in the common bile duct, and the common bile duct opens in the upper part of the duodenum. So there is ascending infection through this opening into the common bile duct. Then for laboratory diagnosis, we have to collect the specimen, fecal specimens. Generally, that part of the feces which contains flakes, mucus flakes, is good for diagnosing coming to a conclusion for the differential diagnosis of the cause of the infective syndrome. It is collected in a sterile screw-capped wide mouth container. In carriers, certain people, like I said, novavirus, the people are carriers also, even in salmonella, there are carriers. So, in such cases, because they are not passing diarrheal stool, rectal swabs can be collected. Rectal swabs are not the sample of choice. Specimens should be transported to the laboratory within 1 hour, because there are lot of other resident flora also, and they will overshadow the pathogenic bacteria. So it is important that the samples should be processed in an hour. If the delay is longer than 1 hour, then they should be sent to the lab in a transport media. Transport media generally helps in the multiplication of the pathogenic bacteria and not of the common commensals. In this lab, when the stool reaches the lab, macroscopic examination of the stool is done, in which the color of the specimen is seen. Color is important because it will let a person know that is it a hepatitis in which the stool becomes clay colored, or it can be red maybe because of blood. Blood can be from the upper GIT, in which it is known as occult blood, which makes the stool dark and not red in color, and if it is red, it means it may be in the lower part of the intestine or colon. Then presence of blood is suggestive of dysentery and inflammatory diarrhea. Adult parasitic forms may also be seen on macroscopic examination of the stool, like segments of the tinea. In microscope, after macroscopic examination, microscopy is done where wet mount of the stool is seen under the microscope. This can identify some ovas and cysts of the parasite. Then there is a hanging drop preparation which is done for Vibrio cholera, where you see darting motility. Then gram stent smears show candida, etc. Modified acid fast staining can be done for microsporidium, and electron microscopy can be done for rotavirus and other Norwalk virus, etc. After microscopic examination, the stool is sent for culture, where you need culture media on which you inoculate the specimen. Then identification of the organisms which grow on the culture plate is done by biochemical reactions, then assimilation and fermentation, etc. Then after identifying the organism, antibiotic susceptibility test is done to find out which the bacteria will respond to which antibiotic. Then tissue cultures can be done for viruses and enterotoxigenic E. coli. Then antigen detection can be done by tests such as ELISA, where rotavirus antigen can be seen in stool, or rapid tests like immunochromatography is available for detection of 3 parasites at the same time, that is E. histolytica, giardia and cryptosporidium. Then latex agglutination is another type of rapid test which is done for E. coli 00157, which is the strain which causes the diarrhea. Then rapid test is also done for Clostridium difficile antigen. Then there are molecular methods like PCR, which can be carried out for any bacteria. Then biofire or film array, this is a multiplex, nested multiplex PCR in which many organisms, syndromic इसमें test होता है, like all the, like there are respiratory panel, there can be a panel for encephalitis, there can be a panel for meningitis. Similarly, there is a panel for gastrointestinal infections, where most of the organisms which cause the GI infections, they will be tested by PCR. These are costly tests and hence not recommended generally. Other methods are a simple methylene blue preparation which will show you the gram positive like candida, etc. Then there is fecal lactoferrin, which can be seen in some infective and non-infective syndromes. Then like in Vibrio cholera, how will we identify? The diarrhea will be very watery and darting motility can be seen. In Shigella, it is generally dysentery, which means diarrhea will have some blood, gram-negative bacilli, which are non-motile. Shigella is a non-motile bacteria. Then Salmonella, inflammatory diarrhea, it is a motile gram-negative bacilli will be seen. In viral agents, rotavirus, all these can be seen by detection of viral particles in the electron microscopy or by ELISA. Then intestinal parasites, they will show in form of dysentery. If it is dysentery, then it can be E. histolytica or giardia. In giardia, there is fatty diarrhea, which means the stool is very fluffy. Then in trichuris, it is plain diarrhea, ascaris, and all these trophozoites can be seen in the stool in microscopic examination. Then the treatment depends on the severity of the diarrhea. Fluid therapy is the mainstay. Generally, if a person is suffering with diarrhea, there is no need to give antibiotics immediately. Generally, the diarrhea is self-limiting, but you have to keep a watch for the hydration of the person. He should not get dehydrated. Then anti-motility agents, which means the motility of the intestine is suppressed. They can be given, and empirical antibiotic therapy is required only in severe diarrhea. If the diarrhea is not responding and it appears that the person will dehydrate soon, then antibiotics can be given. So these are the definitions for mild diarrhea. It is 1 to 2 unformed stool per day. Treatment is hydration and fluids. Then lactose-free diet, avoid caffeine, no antibiotic required. Then moderate diarrhea is 3 to 5 unformed stools per day with or without symptoms, and it interferes with the daily routine. Then fluids and anti-motility agents like loperamide and absorbents like bismuth subsalicylate. No antibiotics required still. But in severe diarrhea, it is 6 unformed stools per day plus temperature, etc. Then ciprofloxacin or levofloxacin may be given. In certain cases, azithromycin is given if Campylobacter is suspected. Metronidazole and vancomycin may be given for Clostridium difficile. There are other infective syndromes like acute nausea and vomiting. This you all understand. Then necrotizing enterocolitis, which is I told you what is enterocolitis. It is the infection of the colon as well as the intestine. If it is necrotizing, which means the mucus is destroyed, then it is necrotizing. Then it can be necrotizing enteritis, pseudomembranous enterocolitis, tropical sprue, esophagitis. You understand, it is the inflammation of the esophagus. Gastritis is the inflammation of the gastric mucosa. Appendicitis is inflammation of the appendix. Diverticulitis, typhlitis and Whipple's disease, I'll tell you. Typhlitis is an inflammation of the cecum, which is the beginning of the large intestine. It is a serious illness that affects people who have a weak immune system. This is generally happening when the people are suffering from cancer and they are on chemotherapeutic drugs. Then this part is generally affected. It is also referred to as neutropenic enterocolitis or ileocecal syndrome or cystitis. This cystitis is different from cystitis, which refers to the infection of the bladder, urinary bladder. Then diverticulitis, there are diverticula, which are small bulging pouches that can form in the lining of the digestive system. Diverticulosis is the appearance of these diverticula which develop in the digestive tract And when these diverticula become infected and inflamed, it is called diverticulitis. This is a very serious condition because it needs a lot of treatment. It may be a surgical treatment later on. Then Whipple's disease is a bacterial infection caused by Tropharium Whipple. Most often affects the joints and the digestive system as well. This impairs the food breakdown. It hampers the body's ability to absorb nutrients such as fats and carbohydrates. So people who are suffering with Whipple's disease, they are very lean and thin and sick. Pseudomembranous enterocolitis is caused by antibiotic associated colitis, or it is caused by Clostridium difficile. This is the inflammation of the colon associated with an overgrowth of the bacterium Clostridioides difficile. Initially it was called Clostridium difficile, now the name has changed. Tropical sprue is the malabsorption syndrome characterized by chronic diarrhea, weight loss and malabsorption of nutrients. It occurs in travelers to the tropical region or the natives of the tropics. So with this I finish the